working at the intersection of mental health and homelessness. So do you think that our stigma and lack of awareness, are they still at the core of the problem, or yeah.
So I think Neha briefly touched upon the statistics in terms of what the scale of the issue is. That yes, I mean, I'm sure most of you have heard about how NIMHANS did this survey in 2019, and we found there are 200 million Indians living with diagnosable mental health conditions, out of which at least 7 to 4 million current prevalence, if you look at it, are people with schizophrenia and bipolar mental health conditions. Can you hear me better now? Yes. Sorry, yeah. So I just want to repeat the statistics that we had this NIMHANS survey in 2019, which spoke about 200 million Indians living with diagnosable mental health conditions, of which a substantial number are also people living with serious mental health conditions, such as, you have diagnosis labels such as schizophrenia and bipolar. One part of it is the scale of it, right? But the most important part that we have learned in the 30-year journey of the Banyan is that when people with serious mental health conditions come to us, they come with a history which is shaped by the social and cultural worlds that they've been a part of. So they have faced caste-based violence. So I've had a client who's seen her son being hanged by a tree because there was a caste-based issue in their village. Stories like this, which are innumerable. So if I start speaking, it'll probably take days or even years to finish. You have families that have really desperately tried to navigate care systems, and then they've met care systems which are very procedural, which don't attend to all of their needs, which think that you can give episodic intervention, you can give this one particular medication, not do follow-up. Because when you live with a serious mental health condition, just like asthma, right? It is a longitudinal care trajectory that you need to take. So you don't move from one crisis to another alone, and that's when care is present. Care needs to be accompanied throughout the person's journey, and it needs to be unconditional and not look for perfect outcomes. Some people may return to work, some people may return back to social roles. So we have many such stories like this. But there are people who may not necessarily make those typical journeys, and yet they can live dignified lives with good quality. So I think, to just answer your question, I think the most important thing I would say is, one part of it is stigma and social exclusion. But what is the genesis of it? There is so much structural equity in Indian society to date, right? Whether it is age-based, gender-based, caste-based, class-based, those which place normative expectations in terms of how a person should appear, what is good behavior, who's also a good patient in some ways, right? So in this book, there are people who talk about, I've sought care for my condition, and then I'm labeled difficult to manage. I am labeled treatment resistant, right? So I think that's the genesis. So one can't isolate, because we have seen communities open doors. So one of the projects of the Banyan is called Home Again, where we try to find homes in the community, rented in the community, for people with serious mental health conditions who've been in institutions lifelong. They don't return back to their families, or they don't go back to work or live on their own. So what do you do with such people? Should they live forever in the hospital? We've had communities open doors, right? But it takes that work of getting your feet dirty, of moving, engaging in dialogue, creating those spaces. So I would say that maybe the narrative of stigma and social exclusion needs much more reflection in terms of where we move forward as a society.